Intracranial hemorrhage. Types of intracranial bleeds explained. IC hemorrhage is also known as IC bleed. Types of IC bleeds are 1. Intracerebral bleed A, intraventricular bleed, B. Intraparenchymal bleed, 2. Subarachnoid bleed, 3. Epidural bleed, 4. Subdural bleed. Intracerebral hemorrhage ICH, also known as hemorrhagic stroke, is a sudden bleeding into the tissues of the brain, i.e. the parenchyma, into its ventricles, or into both. Intraventricular hemorrhage, IVH, also known as intraventricular bleeding, is a bleeding into the brain's ventricular system where the cerebrospinal fluid is produced and circulates through towards the subarachnoid space. Intraparenchymal hemorrhage, IPH, is one form of intracerebral bleeding in which there is bleeding within brain parenchyma. The other form is intraventricular hemorrhage, IVH. Subarachnoid hemorrhage, SAH, is bleeding into the subarachnoid space, the area between the arachnoid membrane and the pia mater surrounding the brain. Epidural hematoma is when bleeding occurs between the tough outer membrane covering the brain, dura mater, and the skull. A subdural hematoma, SDH, is a type of bleeding in which a collection of blood, usually but not always associated with a traumatic brain injury, gathers between the inner layer of the dura mater and the arachnoid mater of the meninges surrounding the brain. Thank you.